Healthcare is often viewed as energy intensive, waste heavy, and incompatible with sustainability. Good morning. My name is Dr. Ira Pearlstine, and my guest today is Dr. Howard Manus, who has been a leading voice in the Green Care Ambulatory Surgery Center certification program for medical sustainability. What does all that mean? And why are there so many excessive costs in running surgical care centers? And why don't we recycle things? Well, Dr. Manus is going to talk to us today about that. Uh, he is developing a program, an initiative that actually reframes sustainability, not just as ideology, but as operational excellence, cost containment, and future-proofing surgical care. Good morning, Dr. Manus.
Good morning, Dr. Pearlstine.
How are you?
I'm doing very well.
Yeah,
thank
so
you.
you're up in Durham, North Carolina now.
We did. We moved from this area up to Durham about 2 years ago.
You were a gastroenterologist here.
I was for 25 years in this area.
And you were on my old radio show.
I was one time, yes.
Yeah, that was fun.
It was.
We would have done it again, but we canceled the show. So
Maybe it was me.
yeah, this is much better actually. So I want to talk to you about this whole sustainability thing. And when we talk about sustainability, what are we actually talking about?
Yeah, we're really talking about the concept of what we call greenhouse gas emissions. Now that's kind of a loaded word, but really we're talking about wasting energy, we're talking about wasting water, we're talking about generating waste, we're talking about causing more greenhouse gases to be emanated into the atmosphere. I know that in this political climate, talking about climate change is somewhat charged. But that's why when we dealt with this concept of sustainability, trying to make healthcare more sustainable, meaning more environmentally friendly, we wanted to tie it to cost savings because that's really was our best bet at getting this thing accomplished.
Well, even in a small office like mine, we don't recycle a lot of stuff.
Mm-hmm.
You know, it's one and done.
Right.
A lot of the newer GLP-1s, you inject once, it's one and done. It's a huge syringe that is disposed of. Nothing seems to be recyclable. And so I'd like to see that we're getting away from some of that.
Mm-hmm.
And perhaps you can enlighten us as we go through the next 20 minutes on the show. And let's see where you are with this. So
I just wanted to interrupt about the medications.
yeah,
One
sure.
of the big problems really is the packaging of these medications. Sometimes you get injectables that come in styrofoam, surrounded by more styrofoam in a gigantic box. So even in a primary care office, I'm sure you generate tremendous amounts of waste just from little tiny products that come surrounded by tremendous amounts of waste.
Well, we're getting better with that.
Mhm.
We've gotten some shipments lately where they request the styrofoam packaging back. We ship it back to them, and they have started reusing it. So it's not as much one and done. I won't mention the names of those companies, but it is happening
Good.
out there.
Good.
So, in essence, what problems were you trying to solve when you helped develop this group or consortium, the Green Care Ambulatory Surgical Center certification program? Was it primarily environmental impact, cost pressure, accreditation alignment, or perhaps all of the above?
Yeah, I think it's all of the above. I'll give you a quick story of my epiphany. I was a gastroenterologist in this town, like I said, for many years. My daughter was the policy director for Sunrise Movement, which was a nationwide youth movement to try to deal with the climate crisis. And as a gastroenterologist, I saw how much waste I was producing. One day I did about 12 colonoscopies. At the end of the day, I asked the nurse, where's all the waste that I generated? And it was quite alarming. So that was kind of an epiphany. So to answer your question, we have something called the Climate Health Organizing Fellowship, which is through Harvard and the Cambridge Alliance. I applied for that along with a group of 5 other people, and we decided that the 6 of us were going to take on the concept of sustainability in ambulatory surgery centers. Ambulatory surgery centers are a big part of medicine now. Everyone who's over 50 should have had your colonoscopy at an ambulatory surgery center, and a lot of surgeries now are moving into the ambulatory world. And we felt this was a great opportunity because there really hasn't been any sustainability movement within this arena.
Well, that's pretty impressive then. So you went from that aha moment of, wow, we're wasting a lot of stuff here, to helping develop
Hmm.
this program. This is a nationwide program, and there are several groups, and you're in the group which is formulating what you're doing in North Carolina, correct?
Well,
Or,
it's only one group that's working on
okay.
this. The other groups in the fellowship are doing other projects. There may be community projects. There may be greening an ICU project. We chose this particular project because we didn't want to just go to the ambulatory surgery center and say, "Hey, do this." We wanted to go to the accreditation organizations, and all the surgery centers are accredited by an accreditation organization. We wanted the accreditation organization to offer this as a voluntary certification, and we wanted to tie it, as you said, to cost savings because surgery centers work on very thin margins. They generate money based on volume of cases, and they work on incredibly thin margins. So if we can offer them an opportunity to save money and also do good for the environment, that was really our goal.
And why ambulatory surgical centers, say, over hospitals or outpatient emergency facilities?
Yeah, ambulatory surgery centers are much more flexible. Most of the ambulatory surgery centers in this country are owned primarily by doctors. Even if they're not owned by doctors, they're owned minority shares by doctors with larger ownership groups. So they can move pretty quickly. If you say we wanted to change, let's say, a device from one device to another device because that device is able to be reprocessed and used over and over again, that can happen next week. So in a hospital, there's just a lot of bureaucracy. As you know, trying to change a hospital is like trying to move a battleship around. It has to go through multiple committees, multiple layers before anything's done. So a surgery center, which I know because I was part of a medical executive committee of a surgery center here in Jensen Beach for a long time, we're pretty flexible. We can move very quickly.
And what misconception about sustainability were you most intent on correcting when you developed this program?
Yeah, I think the biggest misconception is that if you go into a center and say, "Hey, we'd like you to do A, B, and C," that it's just going to cost them money. So we've had doors closed on us multiple times because the thought is that, listen, we're working on thin margins, we're busy. We're very, very busy people. I'm already doing the work of three people. I don't have time for this. I don't have the money for this. And this is just not on my radar. And I think that's the biggest misconception as I went through this is that there are real cost savings that can be achieved here with the endeavors that we work through on the certification. And I think that people have to understand that this goes hand in hand. If you want to do these things to be more sustainable, you are going to have cost savings. Now, of course, there are maneuvers that are made that will cost you money, and the return of investment may be 5 years or 10 years down the road. But a lot of these return on investments are 1 year, 2 years, and there are a lot of state programs available to help you with the investments.
Okay, well, let's talk about those investments because surgery centers have to sustain themselves.
Mhm.
They need their money. Most of them have investors. The investors want to be paid off. And you don't want to end up passing the cost on to patients or insurance companies because the cost of medicine is already high. So for, let's say, an ambulatory surgical center, and let's just call them ASCs for the rest of the show. So for an ASC administrator who's, say, listening to this show today, what's the clearest return on investment message you would give? In other words, where do centers typically see the fastest financial return on their investment in sustainability?
Yeah, I'll give you an example. We had a site visit at an ophthalmologist, that's an eye center up in New Jersey. So my partner, who's Andy Draper of Scion 60, and I went along with another ophthalmologist to an eye center, and we started to look around and we wanted to see where we could get generate the most savings. LED lights are probably the easiest, most low-hanging fruit. For example, at the center, half their lights were not LED lights, and the return on investment for LED lights is 12 to 18 months. And up in New Jersey, they have incentives through their power company to do that with an interest-free loan. We found other areas, for example, in the ophthalmology center, when someone comes in for cataract surgery, which by the way is the most common outpatient procedure in the country. When they come in for cataract surgery, often centers put full drapes on patients, which is just totally unnecessary. There are half drapes. You only need to go to here. We're not worried about their legs when we're doing cataract surgery. That saved a center in New York tens of thousands of dollars. So there's lots of ways to just save money without really any investment whatsoever. We're talking about reusable gowns. We're talking about reusable drapes. All of these things can save money. I'll give you one more example. When a surgeon performs a procedure, there's a tray, right, with his instruments. That tray has to be sterilized. So there's a couple different ways you can sterilize it, and the most common way is something called blue wrap. So they put the tray, they sterilize it, and then they wrap it like a Christmas present. And that wrap is just tossed away afterwards. And there's a company that developed a tray that basically you can sterilize and you don't have to blue wrap it. You just put a cover on the tray and you're good to go.
So I'm seeing this sort of as a ripple effect. You throw a small pebble, it makes just a minor little wave, but by the time it gets to the opposite shore, it could be a major impact. So small little things we do can be big savings later. In other words, just by saving on those gowns, a couple dollars per gown, maybe $5 per gown, would be tens of thousands of dollars by the end of the year, and a lot less medical waste.
Oh, absolutely. And one of the biggest things we saw when we were up at the center in New Jersey is that often centers use eye drops. You get one eye drop before the surgery and then two eye drops after the surgery, cataract surgery, and they often just toss the bottle away after one drop because they think that it got contaminated in some way. So there have been people that have developed products. For example, there's something called Drop Mate, which sterilizes the eye bottle. So you can use the eye bottle over and over and over again. And there's also something called a nano dropper, which is a great name, which twists onto the top of the bottle and gives you the exact amount of fluid necessary for clinical efficacy. So there's just such opportunity there to save money on these expensive eye drops instead of throwing them away. And also these drops just go into the landfill. So all of these things you start to see, like you said, as a ripple effect. There's just so many different little things that can be done to save money and also decrease the waste.
Well, let's talk about keeping the environment clean, but let's also talk about keeping these centers open. And I'm going to play devil's advocate here for
Sure.
just a second because it makes the show more interesting.
Absolutely.
And I've got the question in front of me, and it seems like a really good question. So in real world ASC, ambulatory surgical center conversions, who bears those upfront costs of sustainability efforts? Because you've already said that these surgery centers work on a single digit profit margin. And who actually captures those financial benefits initially?
Yeah, this is a great question because this was an issue we were facing as a group because we felt like going into these individual surgery centers or these large groups, the question was always going to be, I don't have the money for this. I don't have the time, I don't have the money. So we know that there are consulting groups out there that work on the back end. What do I mean by the back end? Well, for example, the consultant group that I'm working with right now, and again, this is on a pro bono basis, we will come in and say, we're not going to charge you anything to do our carbon footprint evaluation. We're not going to charge you anything to come in here and look at all of these processes and tell you what you can do. But let's say we tell you that you should do 10 different things and we think you'll save $10,000 a month by doing this. Well, we're not going to charge you until you actually see those savings. I'm not saying we, I'm saying these consultant groups. So if you save $10,000 a month, a consultant group may say, well, we're going to take $2,000 of that $10,000. You're not going to have to lay out anything. You're not going to have to bear the burden of this up front. a lot of groups that are larger groups, these groups like Deloitte and Mazzetti, these are huge nationwide groups. They'll come in and say, well, it's $100,000 for me to do what I need to do. And most small ASCs just don't have those kind of resources.
Okay, so I want to talk about misaligned incentives because you don't want to do things for the wrong reasons, and this might be a reason why ASCs might not think it's a good idea. And I'd like for you to address these either all at the end or feel free to interrupt me as we go. Upfront costs with delayed payoff.
Yeah.
Yeah. For instance, energy upgrades, HVAC. HVAC improvements cost a lot of money, but yet they're great for sustainability. Waste reduction infrastructure require capital today while savings accrue gradually over years, often beyond a physician owner's expected holding period, because usually ASCs are either owned by a large group, venture capital group, or by physicians, or maybe a combination of both. So how would you address that?
Yeah, the HVAC is a great opportunity, an example, because there are requirements, and it gets complicated, but there has to be airflow through an OR, and it has to happen a certain amount of times per hour. Now, we know that when the OR is not being used, you don't have to have that airflow, and that airflow costs money. So this is something that can be done with literally zero upfront cost. We also know that the temperature throughout a surgery center does not have to always be the same. We all have heard stories of people dropping their loved ones off for procedures, and before they leave the house, they say, you better take a sweater because that waiting room is freezing. Well, why is the waiting room freezing? Because it's the same temperature as the OR. So if the OR is kept at 62 degrees, then the waiting room is kept at 62 degrees. So there's no upfront cost to change that around. We also have sensor devices. So if a room is always has the lights on, well, we have sensors where the lights can turn off if that room isn't being utilized. So these are all scenarios that don't require any upfront costs. They just require changing your HVAC settings around. They just require putting very inexpensive light sensors in.
Okay, then this is a big one. Disposable driven supply chains.
Yeah.
Things come single use, single package, lots of wrappers. Are we looking at this from perhaps the wrong angle? Should we be focusing more at the level of the manufacturer? Because how do we get them to change their distribution?
Yeah.
The SKU units, you scan it, everything's singly done. How do we get things ordered in bulk, in less packaging, but still maintain the sterility of the product, the quality of the product? All these products come with expiration dates, but are they real expiration dates? I mean, is a syringe, for instance, really going to expire? Probably not.
Right.
And why not re-sterilize things in your own office? I know in my office, it costs a lot more money to order sterile gauze. A lot more money, and it comes packaged and it's expensive. So we've started taking gauze and autoclaving it ourselves, and we do it on an as-needed basis. It's
Right.
saved us a lot of money, and I'm sure it's sustainable. So why can't we see this on a much larger scale, and how do we get manufacturers to adopt this process?
Yeah, I think your concept of misaligned incentives is really appropriate in this case, because the use of single-use devices is extraordinary in this country, especially in the ambulatory surgery center, the ASCs. So we think that this is a real opportunity for us in certain areas like orthopedics that use single-use devices. We know that there is the ability to reprocess a lot of these devices where you get multiple uses out of these devices. So for example, there is a company in Arizona that reprocesses cardiac devices, expensive cardiac balloons and catheters. So what they do is they'll collect these balloons or catheters, bring them back, and they have FDA approval to reprocess these devices. And what they'll do is they'll go ahead and sell them back to the company for 50% of what they would pay for a new one. So there's real cost savings there, again, without any outlay of money by the surgery center. I'll also give you a quick example of misaligned incentives. The manufacturers are completely incentivized to sell single-use devices because this is their business model. They make money by selling you one device, you putting it into the waste landfill, and then sending you another one and selling you another one. So these companies have actually sued the reprocessing companies and trying to prevent them from doing this. They have actually put implantable chips into the devices so they only are able to be used one time. They actually have made it so that if you have to plug a device into a generator, that once you use it one time, you're not able to plug it into that generator again. And they sued these companies and they won in court. So the big problem here are the manufacturers of these devices trying to prevent us from being able to use them again and again.
And the last misaligned incentive is sustainability historically hasn't been measured. Now, I know that your group has a certification design process.
Right.
Can you tell us a little bit about that certification design process? Who is actually doing the certification, and what does that mean to the ambulatory surgical center?
Yeah, so that's why we went to distribute this certification to the accreditation organizations because they already have a built-in infrastructure in order to quantify and measure these metrics. So, for example, a large certification accreditation organization like the Joint Commission, they already have sustainability officers. They already have a built-in infrastructure to say, well, we have these things you have to do to achieve a bronze certification, a silver, a gold, a platinum. So in order for you to achieve a bronze certification, it's kind of a bare bones sustainability certification. So you may have replaced the LED lights. You may have developed, you may have taken some physicians and made them officers of sustainability officers and built a plan and are starting to do things. So you may just have an entry level certification. So the accreditation organization has the infrastructure to even do this virtually, to go ahead and say, well, there are 20 things you're supposed to do to achieve a bronze certification. So we're going to see, have you done this? Let's see your energy bills. Are you saving money? Let's see your waste bills. Are you actually saving money on waste? Another concept that we didn't talk about is something called red bag management. You're familiar with this?
Sure.
This is where you have to put items that have blood or secretions, and you have to actually get rid of those in a special way. And this is expensive. I can't tell you how many times in my office I saw just a Doritos bag in a red bag because there's just not education of healthcare workers to know what to do with that. Again, we keep talking about how much of the upfront cost has to be borne by these surgery centers. There's a lot of things that can be done without upfront cost. This is the red bag management is just education.
And the certification, who is actually doing the certifying, and what does that certification actually mean? And can the surgical centers use that certification as a promotional effort to draw both physicians and patients to go there and support those centers in preference to centers that don't have these certifications?
Right. So let's say your surgery center is accredited by Quad A. This is a large accreditation group. Well, Quad A is going to come in and say, we're going to do your accreditation every 2 or 3 years. And by the way, on your next accreditation, we have this sustainability certification available that can be done in a parallel effort with your regular certification. So either they'll make it part of their accreditation or they'll make it a separate accreditation that can be done at the same time. So the answer to your question is of why do I do this? Well, A, I think there's going to be cost savings. B, I think that you're going to attract better, younger physicians who are very concerned about this. There have been surveys that say that 3/4 of the graduating physicians and fellows care about these things. They care about how sustainable your organization is. They care about what you're doing to reduce waste. So I do think that this kind of seal is important.
Sure. And lastly, since you're retired, it kind of keeps you off the streets and out of trouble.
Yes,
Yeah.
absolutely. I am definitely out of trouble by doing this for sure.
Well, you've taught me a lot. I try to do some homework prior to this show and learn as much as I could about what your group does. And I really applaud your efforts.
Thank you.
We're a little bit out of time here, but it's been a pleasure having you, and welcome back. I hope you enjoy your stay while you're down here on the Treasure Coast. This has been another episode of Preserve Health Talks. We'll see you next week.